Georgia here. Georgia's population is 10.6 million people. As of noon today, 3,700 of those 10.6 million are hospitalized with COVID-19, and they have had today 799 deaths.
Given the favorable data, enhanced testing, and approval of our healthcare professionals, we will allow gyms, fitness centers, bowling alleys, body art studios, barbers, cosmetologists, hair designers, nail care artists, estheticians, their respective schools, and massage therapists to reopen their doors this Friday, April the 24th.
And with that being said, Ryan, what do these health leaders actually say the state needs to have in place before they would actually feel comfortable fully with reopening?
Yeah, first and foremost, Aisha, it's really going to be, they want to see increased testing. You know, we reported just last week, the state of Georgia has really lagged behind almost every other state when it comes to testing for COVID-19. The second thing they talked about was contact tracing. It's that ability for people can be able to tell if they have been in contact or been near other people who have tested positive for COVID-19.
Also reached out to doctors who are treating COVID-19 patients to get their perspective on starting to reopen some businesses in Georgia. Caitlin Ross talked to an ER physician who says he expects things will get worse because of this and says healthcare workers are already exhausted.
It is essentially a slap in the face of all my nurses and therapists and people that are on the front lines.
And the president indicated that he's going to talk to the Georgia governor about the opening of beauty salons, etc. But I think,
how do you safely have hair salons and nail salons and tattoo parlors where people this is in Georgia, where people have to inherently be close together?
I think what I've been trying to communicate over the last several days is it's really important that the governors and mayors communicate critical information to their communities and show very clearly the data. Remember, we wanted this data and evidence-based, the data that they utilize to make decisions and the data that the mayors should use in each of the communities, because it will have to be on a community-by-community opening, because there are different communities in different places, even in Georgia. And so I believe people in Atlanta would understand that if their cases are not going down, that they need to continue to do everything that we said: social distancing, washing your hands, wearing a mask in public. So if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people...
As a parent, I am concerned, because what I know is that when I look at the data that we receive from our public health department each day, our numbers are going up. We get a count at noon and we get one at 7 p.m. When I look at the 24-hour period for the 7 p.m. count we got today, our death rate is up by almost 14%. Our positives up almost 7%, and we are not testing asymptomatic and people with mild symptoms. And so it concerns me. I have a great working relationship with our governor, but I did not speak with him before he made this announcement. I spoke with Mayor Hardy Davis, who is the mayor of Augusta, Georgia, the second largest city in the state. He did not speak with the governor. I've spoken with several leaders across the state. So we really are at a loss, and I am concerned as a mother and as the mayor of our capital city.
I have to just get in a couple quickly with you if I can. You've said that businesses have to screen for illnesses. How are they going to do that? So just give the gym example. If someone wants to walk into a gym in Atlanta, and we just heard the mayor doesn't think that Atlanta's ready for this. If I want to go to the gym in Atlanta on Friday, how are they going to screen me?
Well, it's not saying they've got to screen them. These are best practices. They could do temperature screening. You know, they can do the verbal guidelines that all businesses should be giving their employees now, educating them. You do not come to work. You know, the potential for testing now and in the future. So, you know, there's common sense things that people can do. And listen, we're already doing that with businesses in our state.